Hello, everyone. This is Mary Curick with Frontrunners Innovate, and we have a powerhouse of ladies right now, and all of them originally from areas of Africa. One of them is actually situated in the UK right now. So we're going to have a little bit of a conversation about health, health care, patient care, and it's going to be a little bit of a mentoring conversation. And we have another guest that we hope will be able to pop in who's also from the UK. Her name is Michaelene Holdermarch, and she's got a big event coming up that has to do with healthcare and leadership in Africa, but it will take place in Ghana in the next week. So if we are able to get her on the call, that'll be great. She can talk about it. If she's not able to be on the call, when we drop this in and publish it on our website, we'll make sure we drop in the information about that event. And so you don't want to miss that. So we're going to start with introductions. Doreen, you're on camera right now. I'd like you to share a little bit about who you are, what you're doing, and where you're located. So you just need to take yourself off mute.
Hello, good afternoon, everyone. And my name is Doreen Anaya Ando, and I'm from Ghana, and I'm 21 years old, and I'm a student in Kwame Nkrumah University of Science and Technology, and I'm in my second year studying Doctor of Optometry. And
Optometry, yeah.
Yes.
Okay.
Yes. I'm so much interested in healthcare delivery, especially with the eye, because I have a lot of relatives who have got eye conditions and who are not able to receive proper help from professionals because of our poor healthcare delivery services in Ghana. So I moved into the health sector, especially the eye, to help improve upon the health eye care delivery in Ghana. So right now I'm on vacation and I'm interning. I'm having an internship in a clinic, and I'm really enjoying myself with the conditions people come to the hospital with. And I'm enjoying how people receive. And sometimes you are really sad when somebody comes and the person is about to go blind, and the person, because the person couldn't come to the hospital early for early diagnosis of some eye conditions they had, probably because of money issues, financial issues, because they have low eye service at their locations. So some of them have to travel from a very long distances to come to a clinic in the city before they get their eyes checked. And there are some eye conditions before you know it might still there's an eye condition called glaucoma, which we call it the silent theft of sight, because it presents with no symptoms. You just have to get to the hospital to get diagnosed of it. But here's the case in my country: it's very difficult for people to access these services. So I have put it upon myself to help in this eye care services, and I'm so happy that Mom is coming to organize a tech program conference in Ghana, and I'm very happy. So I would like to join so that I will learn more about the technology in healthcare to help the people in Ghana and even globally. Yes, please. Thank you.
Fantastic. Thank you, Doreen. That was really well said, and it hits home with me because I represent a client that has a solution for exactly what you're talking about. He's out of New Zealand and has an eye scan that can detect preventable blindness diseases, along with chronic kidney and heart disease and all of that. Simple eye scan when you go to get your glasses. That would be all it take, and at some point could end up being, your cell phone could be a camera on your cell phone attachment, so it could go to remote places and do a scan. So hang in there, solutions are coming. Okay.
Yes, ma'am.
Yeah, solutions are coming. So Judith, you're back on camera with us, and I don't know if you're working today. I know you're a nurse, so if you'll take yourself off mute and tell us a little, tell us a little bit about you. and what you're doing and what your interests are.
Yeah, like I'm actually on duty, so I have to take some break so as to be in the meeting. I initially thought it was 4 p.m. Nigerian time, so I had took off like break within that period. So when I chatted, he sent a message that you're on another meeting or thereabout. So I had to send a message to the platform. Because of that, I had to reschedule my break. So right now I have to take a little break to be in the meeting. So for me, Nigeria. I grew up in Nigeria and I'm still practicing in Nigeria. And for me, healthcare has been something I've always loved. So far, in fact, I'm also a member of the SDG, Lagos State, Nigeria. So I've been involved. I started practicing since 2018. And since then, I've been involved in a lot of voluntary organizations in the delivery of healthcare. Most times we go to schools, teach them on healthcare. Sometimes we go to hospitals, we go into the community, we go into the churches to teach them to practice. And then there are times to also do a follow-up. But I've been, so like in Nigeria, we have this digital company. I've been able to work with them, so we're able to deliver some of healthcare activities for them. And then also, the ICT came in because when this mental health greatness, when it came in, I was so interested because I actually saw the ICT stuff and I was so interested in technology because I've reached the gap between patients and
Judith, you're breaking up. You're breaking up a lot, so we're having trouble hearing you. So try to, yeah, speak slow. Let me see if that helps any. I think we're having trouble with that. Do you mind if I put words in your mouth? Because I know you. And let me share a little bit. Judith has an interest and has expressed. Yeah, we're having trouble hearing you. It's all
okay.
Yeah.
Okay. Hello.
Yeah, we're not able to get the audio is too rough right now. So just mute yourself and let me tell Angela a little bit about you. Okay. So just
okay, that's fine.
It's really rough. So Angela,
all right, that's fine.
Yeah, there you go. We heard that. That was good. Yeah, Angela, Judith has an interest in that emergency medicine and emergency treatments that people could do at home instead of trying to wait till they get to the hospital. And if I'm saying this correctly, Judith, I think so. But she was looking at maybe app development to see if there was an app that they could have at home that could connect them to someone that would be able to verbalize treatment options of something that would be relatively simple to do and not something that they would have to, go to the emergency room or wait to get into a treatment situation where they could just manage it right there. It would help with the backlog at the hospitals. It would save money. It would save time. It would save a lot of things. So I think patient care is number one on her list for sure. The one thing that I wanted to do is to make sure the girls had a chance to meet you and hopefully Michaelene, if she's able to come on board, because you two are from areas of Africa and also working in Africa. And so Angela, talk a little bit about you. I know we've had you on Frontrunners before, but refresh, if you will, and let these young ladies know what it is, who you are and what you do, what it is that you do. Okay. You're on mute, Angela. There you go.
Trying to mute myself. Thanks a lot, Mary. It's lovely meeting you, Doreen and Judith. And I think that's all on the moment here.
Yeah.
Right. My name is Blessing's come back on again. Like,
Yeah, there we go.
my name is Dr. Angela Unufe. I'm a Nigerian. I was born in the UK and did 10 years in Nigeria. Then I came back to do my secondary school. So I do go back to Nigeria, to Africa quite a lot, sometimes 2-3 times a year. So my background, I was initially an IT consultant previously, but then the passion of wanting to help, improve systems, help the needy, made me go back to uni to do another degree in nursing. So I did that in Republic of Ireland. So I'm a registered nurse in Republic of Ireland and the UK as well. So I came back to the UK and I've been practicing here. I'm a clinical manager, assistant hospital director. I gave that all up because I wanted, my passion to help Africa was, I would say, greater than what I really thought. So I felt this is the right time to do this. But prior to this, I do have NGOs in Africa as well, and I do represent people with mental health and disabilities within the European Union as well. So I was quite spread out, but the passion to actually enhance the healthcare system in Africa it's just literally there was no like it was it. That was what I wanted to do. That was my goal. That was where the passion was. So like everyone else who has passion, you have to sacrifice. So the sacrifice is, yes, I don't have a full-time job right now, but I'm doing what I love doing. So in saying that, yes, I do have a job still as well. I'm a consultant with Infection Reduction Partners. They're a company based in the US who are working on innovation, on reducing surgical site infection across board. And I felt passion for that because I love wound care when I was actually practicing, and I love practicing as well. So sometimes I do go to frontline, but now it's more or less pushing and enhancing, the healthcare system in Africa. My voice is just a voice. We've got so many voices kind of piling in, and this is what we want. You guys are young, you're vibrant, you've got that spirit. Absolutely, this is it. This is the time for you. We can only push, but you guys are going to move it forward and everything. So with that, the decision to actually go out to Africa, to Nigeria, went to Nigeria first and spoke to surgeons about this new invention. It's an irrigation unit to literally, you irrigate the wound after surgical site infection to reduce the possibility of having an infection after you leave surgery. It is being used in America at the moment. Over 3 million 3 million people are using it in over 3,000 hospitals in America. But I thought, you know what? Yeah, it's great. It's in America. Why can't we bring it to Africa? What's stopping us from doing that? And there isn't nothing stopping us from doing that. So yeah, so they were okay. Let's think about this. It's not just coming in to kind of sell a product. It's about teaching. How do we do research? How do we find out if the product does work for us? Because it's okay to say, yes, we've got this research done, it's brilliant, and we can just sell it. But we are actually, what I put forward was, rather than just doing the selling, we are going to work with the surgeons, we're going to work with the hospitals, we're going to create, a research base, we're going to create data, because we all know Africa do not have data. We should be where we are right now, and we all know that. And it's such a simple but very important thing, data, because that helps with allocation of funds. That helps in kind of like, allocating different skill sets and things like that. So there's a lot of things that really depends on data. Let's be clear, some hospitals do have data, some majority don't. But I personally, I can say a lot of the hospitals I have been in contact with don't have data, and that is so key for us. How can you write about something without having, evidence? Evidence is the data. So we're going on about, oh, we need data. How are we going to do that? What implementation do you have? What process are you bringing? So hopefully with Infection Reduction Partners and trying to reduce surgical site infection, we're bringing that in. We're bringing in the knowledge. We're bringing in a system. We're bringing in, a working process where you can see there's a protocol, there's this, there's that, we do this, and then this is the data. The data is not just for us, it's for the whole world. We want to share that data. We want to empower the surgeons, the nurses, the post-operative nurses, everyone. And when I went first to have the visit in February this year, because it's easy to talk about, oh yeah, we can do this, we can do that. Africa is a very, very difficult place. And you live in there, you know how it is. Things are not straight. There's not, you know, there's no phone call at the end of someone answer the phone and tell you what you need to know. No, it's not like that. You literally have to invest a lot of time and a lot of unpaid time, a lot of, you know, that passion is where you really would rely on this, because you need something to push you when people closing the doors on you. When people say, oh, well, I don't think that will work. Oh, no, that's too costly. Or people always have those mindset. It's for you to change that mindset by trying to educate them on why you wanted to do this and what's the benefit. The benefit has to outweigh everything. So in this light of reducing surgical site infection, obviously in Nigeria and in Ghana, they use a system right now, but we know it's not working. So how do we kind of like try to implement without changing everything? And a lot of the surgeons, it's not just the surgeons I focused on the chief medical directors, the CMAC, everybody from the top. I had to get them involved, because it's easy for us to just go straight and just do a lecture, and then everybody will like, oh yeah, that's brilliant. But no, they're not the decision makers. The decision makers are the people in the Ministry of Health, the Permanent Secretary, the chief medical directors, the accountants, the pharmacists, all of them together. We had them in one room in different hospitals, and we spoke to them about the need for them to look at this product. It's a new invention. It works. Can we try it? Should we do this? And yes, we were met with like, no, not really. No, we're not going to do that. But at the end of the session, 3 hours into it, and they were like, when are we going to start using this? For me, that was the goal for me, because I knew they were going to say no. I knew they were going to say, no, we're happy with what we're doing. But what you're doing, it's not helping our patient. It's not about what you want to do. It's about what our patient would actually benefit at the end of it. So the benefit is they spend less time in hospital, they go home a lot healthier, they're not spending that much money. So there's a lot of benefit to that. So we need to look at that cost to the patient of the healthcare. And in Africa, majority of the patient pay for their care. It's not like in the UK where you have the NHS and everybody pays into and makes a contribution into the pot. We don't have that in Africa. Yes, sure, some private insurance, that's starting up. In Nigeria, we haven't got there yet. So people rely on funds from family, from money they want to use for the children's education, you know, so they're literally dipping into things that they shouldn't dip into, but health is wealth. Without health, you have nothing. So you can see the amount of reduction, the stress level you're taking away from your family member who's going to surgery, because you know at the end of the day, hopefully the instruments and the things they're going to use is going to save their life, of course. And of course, we've got the surgeons who are brilliant at that job, but we need to equip them with the right equipment, and that's where I fit in. Let's do this. And it's not just about the surgery. There's a lot that comes into it. And Jude, if you would know, as well as Doreen, you're working in the medical field. It's about everybody from the ground level up understanding infection control. A lot of the hospitals I have visited do not have an IPC compliance. And it is shocking, it is scary, but it's something we can actually tackle and do well. So with this invention, we're going to Nigeria, this innovation, it's not just the surgeon. We will be like training everybody down to the patient on how to care for themselves, because that's the circle. You can't just say, oh yeah, we just stop. Yeah, once you go to the theatre, comes back and that's it. No, what we're doing afterwards, how are we monitoring our infection control? What, you know, is there a normal audit? Is there compliance? So all that, what we do here, I'm just going to replicate that in Africa. So I'm not doing anything new. I'm just literally bringing what I've learned, knowledge, back home to train, to educate, to empower, and hopefully the same standard that we use here in caring for our patients, It's the same standard should be across board all over the world. So that is my passion and my goal in what I'm doing right now.
And we feel it. I love that passion from you. What I'd love to do is entertain some questions from the ladies here. So either one of you have a question of Angela, just about what she does, how she transitioned into the works that she's doing, how it might relate to what you want to do. Judith or Doreen? Question? Judith, any comments? Because I know that you're in Nigeria. See if we can hear you this time.
Yeah.
Oh, wow.
All right. Judith, do you want to type the question?
Yeah, Judith, if you can type the question in the chat, we might be able to get it from there. But yeah, you're breaking up again. Type it in chat and then Angela can see it. Yeah, it's just the audio is awful. Yeah. Get it into the chat box. Just type your question into the chat box and we'll catch it from there.
Yeah.
Okay. Doreen, while she's doing that, do you have any comments or questions?
Yes, ma'am.
Okay.
Okay. I wanted to ask, what was your first line of action you made when you realized that was the passion you had? What was the first thing you did? Did you consult any, let's say, senior colleague or something? Because here it's very difficult for you to locate somebody you have the same passion with. So when you realized that was what you were interested in, what was the first thing you did? That is what I want to know.
Thank you. Well, that's a very good question, actually. So it was a mixture of so many things. The passion to do what I wanted to do has always been in me. I've suppressed it because of family, bills, everything else you want to do in life. You know how it is. But it does get to a point and you think, this is not me. And people are telling you as well. Your colleague is saying, well, you shouldn't be here. The way you think, the things you do, you know, and that is like a wake-up call. And that was a wake-up call for me, that I felt this is the time for me to do this. I feel I have accomplished my goal within my career. I wanted to be a hospital director, and I became a deputy hospital director, and that was good enough for me. I felt that was it. So I had a goal in my personal career, and I've accomplished that. So at that point, I think during COVID, I made that transition and felt I need to do this, I need to fly. And spoke to my managers. Of course, they're not going to be happy because they're losing, you know, a workforce. But it was difficult, but I was very happy. But happy to a point of the unknown. Where do I go from here? But then during that time, I was now working when I want to. Why I had more time I invested more time into what I wanted to do, the passion in relation to NGO, supporting other NGOs as well, trying to get myself out there. And then obviously via LinkedIn, someone contacted me, and then that's just where we are. So I'm actually the director of clinical affairs for infection control in Africa. So it's something I want. I love talking, I love, you know, teaching, I love educating, I love mentoring. So yeah, so I'm just right where I want to be. But like you said, the question, a lot of people gave me the hint, and COVID was it for me as well.
Good. I see where blessings indicated to Judith. Judith, if you will turn off your video, you might be able to enhance your audio, so we might be able to hear you. So Judith, if you want to turn off your video but keep your audio on, okay, then we might be able to hear you. You want to try that? Looks like she's working on it.
Yeah. So yeah, so Doreen, did I answer your question?
Yes, ma'am, very well.
And another thing as well, I always say, always talk to your family as well, because you can make a decision that could be life-changing. And my decision was life-changing in relation to the fact that I'll be traveling a lot. I'll be away from home. I have been talking to my kids about it for a very long time. I'll say 2015 when I made my first trip. And that's when I knew that, yeah, and they know. So when I'm not around, they're like, yeah, mom's gone here, she's okay, and that's fine. So yeah, so it's a life-changing thing, but having supportive family and kids helps because they know this is me. Yeah. Does that answer the question?
I think it did. Yeah. Judith, you've gotten your video off, so try to put on your audio now and see if we can hear your question or your comment. See if you can unmute yourself and then ask. I think the struggle is real today, Angela. The struggle is real.
While we have, is Blessing able to ask a question, or because I can see she left a message, but is she on at the moment? Does she have any questions to ask?
Oh, Blessing. Yeah, Blessing, do you have any comments or questions? You can come off mute if you want to and check in.
Yep. While we're doing that, Doreen, just a quick question as well.
Thank you so much. I was on.
Here we go. We got Blessing. Okay. Go ahead, Blessing.
All right. I was off and off some time, so I didn't get most of the conversation. But for the short one I heard, it's really insightful. I just want to celebrate it, Dr. Angela, for what you've done. And yeah, thank you. I don't really have a question.
Well, that tells us everything we needed to know. Nigeria is the problem today. Blessing, we got a little bit of what you said. So, and I think I got the gist of it, but it's kind of like Judith when she's on audio. It's really tough. So I don't know, Judith, do you want to try one more time to talk to us? You can get off mute and talk. Either that, or you can put a question in the chat if you want to. I think what we're dealing with is Judith is trying to be at work as well. So, as a nurse, this is the one thing about the US when we change our times, with the daylight savings time, and that is what we've done now, is switch back. It got everybody out of whack this go around. But I was hoping that Michaelene could be here. She has not been able to show up, so that lets me know that she's working hard on something else that's going on. But we will provide all the information about her health leadership conference, and she's got some amazing speakers lined up in Ghana. And I think that it will be definitely something that will be worthy there. I see we've got a raised hand from Doreen. Yes, ma'am. You have something to say?
Yes, please. I wanted to ask another question.
Yes.
Okay, go ahead.
Okay, so I know currently you are now in the workforce, but for me, I'm a student. I wanted to know, right here in Africa, we are bombarded with a lot of things theoretically, and we don't have our hands on the practical aspect. So I want you to give me any advice on what to do, even as I'm a student and I'm in school. Because I know when we come out of school, we'll be involved in more of the practicals than the theoretical. So I want you to give me an advice, what I need to do, what I need to know. Yes, please. Thank you very much.
Thanks, Doreen. That is absolutely a brilliant question. And literally what you said is, in Africa, it's all based on, like, there's more theory than practical. But I'll be honest with you, in medical field, it has to be both. Yes, I was very fortunate to have a training in Ireland where we had a clinical lab. At the moment, I am working with the medical university in my dad's state to create a clinical lab for them, for all the students, the medical students. So I totally understand where you're coming from, because I cannot understand how you can base your experience on theory only. It's just not in this day and age. And we have so much technology that we don't have to even be there. I can actually lecture you from my home here in England and you are in, in the lab. So there are a lot of things that, we need to do. We need to kind of voice out to the ministry, to the educational ministry. It's not just about theory. Yes, brilliant. Africans are great in theory because all we do is study and cram the books. But when it comes to practical, that's where a lot of them fail. Of course, I said to you, I mentioned as well, 2 of my nurses just finished with a first class. One just came from Nigeria a year ago, and the other one was about a year and 6, and the other one's from Ghana, a year and 6 months. And I'm so proud, when they're on shift with me, I made sure that they did what they needed to do, because without practical skills, it's going to be very difficult. And the fact that you're studying, oh God, you need technology. You need to know what you're doing. You need to know what this is in the eye, why this, why that, what does this look like, things like that. So you definitely need hands-on. I mean, the school, the university you're training needs to invest in that. Hopefully, and I hope you will mention something like this to Michaelene. You mentioned that to her. It's something that we could work with the university or the school to bring in. But it's so important, so needed. I mean, here we take it for granted when we're like, oh, we're going to clinical lab. But when I went to Africa and I was like, they were showing me just the space, I was like, okay, great. So what we're going to do here, oh, this is where the clinical lab is going to be. They're actually building it. And that was fantastic, because that was something I was actually advocating for. So I was so happy to see that. Still a long way to go. But in relation to that is the fact that they're thinking about it, because that's the way forward. The whole African universities should do the same. You need a clinical lab for you guys to do your experiment, to practice until you become perfect. Without that, you cannot. Theory can only take you so far. So that would be my answer to that. That I would want to follow up on that, actually, because it's kind of shocking that yeah. So what do you do now?
Yeah, Doreen, how are you, if you're just learning textbook stuff, how are you, there's no practice at all? There's no experience part?
The practice is when you go out for attachments and internship.
Oh, as an apprenticeship or something like that, right?
Yes.
So before you even go out and touch somebody's eye, you've never touched somebody's eye before? Or never had that experience before?
Right now, we are on vacation, so we are having an internship and attachment. That is when we see real cases. But when we resume and go to school, you have to learn more of the theory.
Yeah.
So that's when you come back and you're having your internship, then you have your hands on real cases.
The blessing is putting up something saying, yes, virtual reality. There's so many ways to learn with simulation and virtual reality that will, along with what Angela said, is she could lecture from where she is now. So it's that long distance learning, I mean, actually kind of helps you. And then working on a project with somebody who's in that space, I think would be of some help to you. I see where Judith, I asked her to go back out and come in because she can't hear anybody anymore is what she's saying, but she's thanking you, Angela, and indicating that, she knows that you're working with some Nigerian hospitals. Even if she can't hear and she's not on, this is being recorded, so I can send it to her later. So do you want to answer that now? If she comes back on, we can get you to talk about that.
Fantastic. So in relation to Judith's comment, yes, I initially reached out to 3 government hospitals in Nigeria, but now I can tell you right now, after my last trip, I have over 60. So working through them. At some point, we'll kind of meet you guys in different hospitals. And obviously we're coming to Ghana as well. So that's the other thing I was going to say to Doreen. We're just literally working on that right now. And I'll be working in Ghana as well. So yeah, it would be really good to kind of, kind of connect. And I love the way Mary's mentoring everyone. I'm happy to support in any way or form. If there are things you feel you want me to get for you, educational materials, not theory, practice and stuff, like a link, a free WHO training guide, things like that, I can get that for you for free. So
Wow.
all you need to do is just let me know what you want, and I can actually just churn out the training session to you, because I do it myself, and I actually make sure my students do that. So yeah, I'll get you on board. So you tell me what you want, and I'll be able to source it out for you, and you don't have to pay for it.
That's perfect. Perfect. I love that. Look at her grinning. She's ready. She's on board. That's good. And I feel like Judith will be too. The idea behind also of introducing this is Doreen, if Michaelene was on board here, she is working this event in Ghana, and we need to get you two connected in a way that you can start talking about what you can do to help her with that, because healthcare is between the both of you. And
Absolutely.
Angela, Judith is your girl. Here she comes.
This is it.
Your nurse in Nigeria.
Yeah.
You can,
So I think she was saying, any plans reaching out for more?
out for more hospitals.
Yeah,
Now she's coming back on, so hang on a minute. Let's see if we can get her to
fantastic.
hear what we're doing.
Yeah.
With that, at least she can hear maybe part of it, hopefully.
Yeah, definitely.
So, and I do see her as is possible to help you kind of get the word out into some of the hospitals there, since she is working in that environment, and she also teaches at some different places in Nigeria. So education piece is really important. So yeah, she's getting connected with audio. I'll give her a second. Okay. Hey, Judith, can you hear us now? Judith, let us, Judith, let us know if you can hear us. Okay.
Yes, I can hear everyone. No, I can hear. Thank you.
Judith,
I've missed a lot already.
Good. Judith, Angela is going to answer the question you put in the chat right now. Okay, so listen up. Yeah, put yourself on mute right now so that we don't hear the background. Let her answer that question. There we go.
Oh, great, Judith. Glad you connected back. So in relation to the question, yes, when you read the profile, we have 3 hospitals. Now we have over 45 going on 60. Of course, regardless of the speciality, we are just going to do some educational work with infection control and things like that across all hospitals. It's just, I've got a massive goal. It is really massive, but at the end of the day, nothing is, is bigger than me. I will try and do my best. Creating a place or a center for excellence is not easy. And Nigeria has so much, or should I say Africa has so much talent, but the talent is all within or exported out. So the ones within now, let's empower them. So I'm hoping to do that in relation to research, studies, showcasing the work we're doing. Everything we're doing in this initiative will be showcased to the world. And hopefully, my goal is to actually implement this as part of the WHO surgical intervention around the whole world. So that's my goal. So that's what I'm working towards as well.
Boy, you weren't kidding, massive. That is a massive goal. But that's what we know about you. And I love what you said, nothing's bigger than you. So you tackle whatever is out there. And honestly, if you don't have a big enough goal, then there's not enough motivation to really get it going on. So I was just saying, Judith, right before you came back in, that we are kind of connecting you with Angela proper, because
yes, I'm back.
Nigeria is
everything she
hot
said
spot right now. So yeah, and so you two are connected. Oh my gosh, here comes Michaelene. No.
Doreen, the main woman, is coming in.
I know. We only have a couple of minutes with her, but we got her on, so this is good. Get her in here. Yay, Michaelene.
Hi, I'm here.
Yes. Okay. You're at the tail end. We're at the tail end, but it's good to have you here because we want you to be able to speak just a minute or two about the event you've got going on next week. So But we've been chatting for a little while, so we're at the tail end of this, but I'm so glad you made it in. So
Yeah, because
tell us-
I thought it was 5 p.m. English time because
yeah.
it went back. The time
Yeah.
went back for us. So
It went
hi,
back to me.
everybody.
Yeah.
Hi, everyone.
Welcome
It's
to
great to be here.
Yeah, so talk to us a little bit. Everybody else has
Good
introduced
evening.
themselves. And when we go off of record, I'll get them to do that again with you if you would like. But Michaelene, tell us a little bit about yourself, and then let's talk about the event before we get.
Okay, so hi, everyone. My name is Michaelene Holdemarch, and I am the founder of the Leaders in Health and Tech, and MHM Health Consultancy is my consultancy business that has been in operation since 2005. I have a registered office in Ghana. My background is law and health and digital. And I've been championing for a long time for us to improve health, but actually engaging with communities and also engaging with healthcare professionals themselves to share the information that they have that could actually really help to improve accessibility in any region. And the thing about it is that we have health professionals who are very innovative. They have health professionals with so many great pathways development. And it's a way of actually sharing that across the board so people know what you're doing and probably getting on board and networking like what you do, Mary, which is really great, connecting great minds. And I think that's really wonderful. Not that I'm a great mind, but it's great to be connected with greater minds.
Oh, we all here are great minds.
With greater minds. So to put it into context, I am from Trinidad and Tobago. I've been living in the UK since I'm in my ones. So I'm no longer in my ones, and I'm not in my twos, and I'm not in my threes, and I'm not in my fours. So, you know, it's been a long, long time. And I really believe in the diaspora, and I believe that so many people from different countries, my Caucasian brothers and sisters, have actually pushed me to get me to where I am. And I believe in humanity. Humanity comes in all different shades. And it's time we do all together, join together and improve health for people who are poor, needy, just don't have the money. And not only that, they don't understand what is going on with them, and they need you to be an advocate. Mm-hmm. So whether it's the gypsy community, whether it's whoever, once you can step in and let humanity serve, I think we can be a greater world. And so that's my passion. So that's my legacy, is to help everyone who, as long as they need some sort of support in the healthcare and digital impact. Because I won't stay long, Mary, but one of the things that is concerning me at the moment, is biting me and nibbling at me, is that banking processes have changed. And therefore, the elderly find it very difficult with all these passwords and all these online banking, and they have to trust someone to put it on their system for them and also teach them. And I think that is mental health stress. It is a stress on them. So many have lost money, so many just don't know how to do it. And whilst banking systems are running ahead, they are leaving out key people, not only elderly, other people who just don't understand the savviness behind it. And so they're left behind in this digital world that we are creating. So that bugs me. It really bugs me that banks are not looking at people who just don't understand the modern system. Okay, that's me complaining. I'm done.
I'm married to one, so I understand. He still has a flip phone, and Verizon has already told him, you need to turn that in. We're no longer supporting that. And he's about to have a freak out. he's
totally. My mom too. My mom as well.
When he gets a text message and he wants to forward it, he gives it to me and he says, forward this.
Exactly. And my mom is like that too. My husband believes in the old time rotary phone. Yes, he's good with that. So yeah,
online banking, no way.
Yeah, but seriously, it does not encompass the needs of those who just don't know how.
It doesn't.
Or have the support like you have the support and willing to help. And it's open for abuse as well. And
Right.
I think that's
Definitely.
my concern, is the open for abuse.
Absolutely. So Michaelene, we were talking a little bit all along through this conversation we've been having about the event you've got coming up in about another week or so. Share us a little bit
Next
about
week,
that.
next week.
Yes. So talk to us about it. We want Doreen to try to help you a little bit with that.
That
because,
would be
She's
great.
there.
That would be great to have you, Doreen. Please come down. It's at the Labadi Hotel. And Friday it's live. People are coming in from all over. And they're coming to participate. And we have Deputy Minister Fatimatu Abu Bakr, who is coming to be there, and other well-known Ghanaian. USAID is coming. Someone from the British Embassy is coming. So it's really, really good. And what we're doing this year is, one of the key discussions that we'll be having this year is the business impact on health. Because we always talk about health, but we don't talk about the value, the money, the economics behind it. And it's time we start talking economics. And it's time as women, we start taking control of economics in businesses, and not just accepting whatever is the flow. So come down. It's the 18th and the 19th. The 19th is all hybrid. It's all online. And Mary, I would like you to do an opening remark for the Leaders Health and Tech.
Oh my gosh.
Brilliant.
Yes, we would love for you to give us an opening statement. You could either do it on a Friday or the Saturday. Let me know what is best for you, and we will just bring you online for you to actually meet people and say a few words. I really would appreciate that.
Okay. Very good. I will make a point of that. Doreen, I don't know where is it going to happen in Ghana, Michaelene?
It's in Accra, and it's at the Labadi Beach Hotel. Doreen, where are
is
you?
that anywhere where you can get to it?
Okay, so currently I'm in Cape Coast.
We can't hear you.
Cape Coast. Yes, I know Cape Coast very well.
Yes.
Very well. So you're quite a bit of a distance, but it's not so bad for you to get down to Accra.
Okay, so I don't know, but on the Friday I'll be having an attachment in a hospital.
Okay.
So I don't know for the Friday, but I'm sure to join on the Saturday.
Okay, so Saturday is mostly hybrid, but I'm there from Wednesday, and Thursday I'm having a big birthday party for my mom at the Gold Coast restaurant. She's having breakfast at the Labadi, and then we go to the Gold Coast restaurant to celebrate her 74th birthday.
Oh, wow, that's perfect. That's awesome.
Yeah.
Congratulations.
Yeah. So that's what we're gonna be doing. I can't wait. I love jollof rice from Nigeria, and I love jollof rice from Ghana. So I'm all good. Yeah.
You're gonna get it all. You're gonna get it all.
Yeah. And
Well,
I like
I'm
all
hoping that the two of you get a chance to meet, because the idea is, while Doreen is there, and she's a student in optometry there, in Ghana, and has
we know some great ophthalmologists who last year we gave awards to. So if you need me to link you in so you could do a bit of work with them, just let me know. That's not a problem.
That's perfect. Okay.
Yes, I'll be grateful.
Yeah, that's not a
You got a
problem.
great smile. I love her smile. Okay,
Yeah.
so Doreen is your kind of like mentee for, or interim for a couple of weeks. So use her
Yeah.
however you need to get the word out.
So if you can come down, it'd be great to have you. Please know, we'd be wonderful. And just to let you know, there's two things. We are launching a patient system, digital self system in Ghana on the Friday. And what it is about you having your records on your phone. So if someone get a snake bite or any injury, they have it all on the phone. They don't have to go, when they go to the doctors, they don't have to explain who they are. Everything is on their phone, really compartmentalized. And we're selling that. That's a subscription. And the other thing, I just signed a contract to supply nurses and doctors from Ghana and Nigeria to different parts of the world. So I'll have an office in Accra, and I hope that you'll be able to come down and see what I do.
Yes, Make it a mission, girl. Oh, awesome. I do know Blessing had a question or comment for you in the chat. She says she's working towards switching to a career as a health and wellness virtual reality content designer and strategist. So she's good to know that you are all about digital health. So
yeah, informatics is key. I am one of the NHS digital people. I'm also a data CIO for MIT globally. So yeah, data is king. Informatics is the way forward. If I have to advise people who want to think of a career in their 60s, 50s, I would say go straight into digital data. You're guaranteed to earn a very nice income. And you're guaranteed to actually be really, especially to deal with cybersecurity, because you can lie down in your bed and be a consultant for that and earn a tidy and be and get a tidy sum. Yeah.
Very good. Awesome. Well, we need to finish this up, and then if you guys will stay on for just a minute afterwards, do a little bit more connecting. And thank you. Let's see, Judith, where are you based in Nigeria? Let's answer that first. Judith, where are you in Nigeria? I want to say she's in Abuja, but I could be wrong. Judith, can you answer?
The weather is very, very bad at the moment in West Africa.
Yeah, we've been having a real hard time with audio. I mean, it's verbally.
Yeah, it's really, really bad in West Africa, and I'm hoping that it would be better when I get there, but it's really bad. And I think it's because they had the floodings and they had all of that. It certainly has impacted on their IT systems.
Okay. Well, we'll answer that off record, but want to say thank you to everybody that's here. And honestly, what a great group of people, young and then others that are more experienced, and everybody that's coming together for healthcare in Africa and around the world, actually.
Yeah.
So thank you so much, everybody, and just stay on. And I'm going to ask everybody who's watching this on YouTube to go to www.frontrunnersinnovate.com, where you'll get this interview and a lot of the information, particularly the flyer that I'm sure Michaelene will share with us for the event. And then also, Angela, if there's anything else that you would like to share with us for upcoming, scenarios that we've got going on there with infection reduction partners, happy to reshare that for sure. So thank you, ladies. I appreciate it. Take care.
Thank you. Thank you so much, Mary. You're a star. Thank you.